Thank you so much for the invitation to share on the WHO Global Initiative for Childhood Cancer. And today I'll be talking about increasing access, advancing quality, and saving lives. So this slide is talking about the global challenge to access quality childhood cancer. And you can see the issue, 18% of children with cancer will survive in the high income country, compared to only about 20% of children with cancer who will survive in low to middle income countries. And from studies that have been done, childhood cancers are not included in National Cancer Control Plan in about 44%, 42% of the countries. A minority of countries include childhood cancer in their benefit packages. Only 1 in 4 countries have data to inform planning, and there's limited implementation with very limited capacity building and also workforce that is available to work in childhood cancer. This slide is what is really important and why one of the reasons why we have the WHO initiative for a global initiative for childhood cancer. Avoidable deaths from childhood cancer in low to middle income result from a lack of diagnosis. There's misdiagnosis or there's delayed diagnosis. We also have obstacles to accessing care, abandonment of treatment, death from toxicity, and higher rates of relapse. And if you look at the low to middle, low income countries first, you see that over 50% of the deaths are due to no diagnosis. We have about 10%, 5 to 10% of the deaths because of misdiagnosis. And we do get quite a small proportion of children, less than 10%, who are actually being cured from childhood cancer. And because of the background that I have given, which is talking about survival rates of less than 20%, only about 20%, this global health inequity is what led to the putting up of the Global Initiative for Childhood Cancer. And this came about in September 2011 during the UN General Assembly, a meeting on NCDs that was held. And this led to a lot of political commitment at the high-level meeting at the UNGA. And as you will see from this slide, it's really giving you the various points that we have taken to bear where we are. The key point is that in September 2018, during the UN General Assembly, the WHO Global Initiative for Childhood Cancer, following the high-level meeting on NCD, was launched in September of 2018. And this came after the stakeholder meeting at the WHO, and I know some of the people that are present today from SIOP were present in that meeting in August 2018, which was the first a stakeholder meeting on childhood cancer, a great milestone. And we know that last year we did celebrate 5 years. This was the WHO Global Initiative. It's a partnership with St. Jude together with other partners like SIOP, which started in 2018. And this will go on up to the end, up to June this year. Initially, it was a 5-year program which was supposed to end in December of 2022, but has been extended for 6 months. And as you see, number 7, this is the June 2023 ending of this initiative. What is this initiative about? And that is one of the things that we want to. What is the goal of this initiative? The Global Initiative for Childhood Cancer is an initiative which is looking at achieving at least 60% survival rate for childhood cancer globally by 2030 and reducing suffering for all. And in addition to that, this will lead to serving 1 more million additional lives. What are the key objectives of this Global Initiative for Childhood Cancer? It is to increase the capacity of countries to provide quality services for children with cancer and also increase the prioritization of childhood cancer at global, regional, and national levels. And I did mention that there are very few countries that include childhood cancer in their national cancer control plan. And we see that in the benefit packages that countries have, there are very few countries that are putting childhood cancer in the benefit packages. It is estimated to be implemented in over 25 countries by 2021 to 2023. We know that over 70 countries globally have been involved. In Africa, and I will talk about it later, we have 8 focus countries. What are some of the expected outputs and activities at national level? We're expecting that countries will have country assessment, there are case studies that have been done, and general implementation plans which will be of help. Global, regional level, like our level here, we are looking at regional assessment, and currently we're carrying on a status report on childhood cancer in Africa and hope to have these results soon. At the global level, they're looking at the global framework and the technical package, which I will talk about. So the approach to the GICC, the approach is through what is known the Cure-All technical package. Cure-All, as you can see, C is standing for the Centers of Excellence and Care Networks with sufficient competent workforce, universal health coverage with benefit packages and organization models for quality services. We're looking at benefit packages which are inclusive of childhood cancer, regimens for treatment, which are context appropriate and that will have guidelines, essential technologies and medicines that are context specific as well. And one of the things that we have been lacking as a region is having data. So evaluation and monitoring with quality assurance and information system is key in the GICC. And the enablers for it is advocacy. It is linked to advocacy, leverage financing, and also policy and governance. We have seen examples of where this has been very well implemented. On the country level, we have what are known as the core programs, the core priorities of the GICC, and these are 10, and countries did sit around the table, the focus countries, to be able to determine which are the focus, the priority projects that they want to undertake. Most of the countries in our region had National Cancer Control Strategic Development Implementation. They also put in defining of national standards and guidelines for index cancer. One issue, 85% of the countries will ask for essential medicines and technology strengthening. We find the countries also put forward in the Africa region, strengthening and linking of cancer registry, population-based and hospital-based cancer registry. And of course, that there needs to be advocacy, case studies, awareness campaign, and we've seen a lot of that going on. What are the key elements that will make country impact? We need to have leadership by the Ministry of Health, and that there should be domestic financing, domestic resources that are coming on, and at the end of the day, when we find that the Ministry of Health has a strong focal point, presence of fully committed. So without commitment, the presence of an established unit at the Ministry of Health, we have found that this can lead to delayed implementation of childhood cancer. So key is that we're looking at 6 index cancers in the GICC. We've got acute lymphoblastic leukemia, Burkitt's lymphoma, we have Hodgkin's lymphoma, retinoblastoma, and you can see the reasons why Wilms tumor, low-grade glioma, why they were chosen. Acute lymphoblastic leukemia, most common worldwide. Burkitt's lymphoma, common in many low-income countries like our region. Hodgkin's lymphoma is common in adolescents. Retinoblastoma, because it is a connecting communities and the possibility of early diagnosis in it. And then we have Wilms tumor, which will bring the multidisciplinary services that we need. And then, of course, the systems being connected by low-grade glioma. The other reason is that these cancers are highly curable with proven therapies. They are prevalent in all the countries, represent 50 to 60% of all childhood cancers age 0 to 19 years old, and helps to advance comprehensive childhood cancer services and system strengthening. One of the key issues that we had to look in is who can be a part, who can be a focus country, and there are many levels of engagement, and I will talk about that. So I have talked about high-level political commitment, that the government is able to provide, that they are committed to this cause, that there is somebody who's available who will be specifically looking into childhood cancer. And if you can be able to share the organogram that shows us that this has been put in place, this is a focal person, and also that there is integration that is currently going on. It's that what we want to see is childhood cancer is a priority in your country, and we want to know which partners are working with you in childhood cancer itself, in child healthcare interventions, if you can provide a list to us, and then what policies currently are available in your country that are looking into childhood cancer. And we want to see, do you have a national cancer control plan? Is it inclusive of childhood cancer? Do you have treatment guidelines? Do you have a registry that is collecting information on childhood cancer? An example of one of the countries that put in a brilliant application. They told us the country status, they attached the document describing the status, they developed action towards a GICC criteria item. They even told us the steering committee, particularly for childhood cancer, and they provided an implementation work plan for GICC. Where are we currently? As far as the African region is concerned, currently we have about 60 countries that we are engaged in, 8 focus countries, that is Ghana, Zambia, Senegal, Zimbabwe, Cameroon, Uganda, and Ethiopia, and Kenya. These are countries that have formally written to the WHO and have formally the criteria that I talked about, they've alluded to it and how this is being implemented. We have countries in initial phases, the countries that are implementing some of the identifiable cure-all projects. And regarding to one or more of the pillars, I talked about the pillars that we have in cure-all. And so we have South Africa, we have Mali, we have Benin, and we have Tanzania. And then we have countries where we're having ongoing dialogue. And these are countries with expressed interest in strengthening childhood cancer, like Mozambique and Burundi, and Tanzania should be removed from that list. What achievements have been made in the last 5 years? Remember, we were hit by COVID, so we did have a 2-year break, so this was a very difficult time to implement. Under the cure-all framework that we've been working in, we have seen that in terms of centers of excellence, we have seen new training platforms, training networks developed, implementation of workforce optimization strategies. We have seen, for example, implementation of cancer workforce training packages in Zambia, where they actually develop a curriculum for non-pediatric oncologists that general pediatrics can use, the nurses can use. We have seen it in Ghana. We see networks, national networks and referral pathway strengthening that will come in the following countries, and there's an example of Ghana and a story that about that. Under the universal health coverage, childhood cancer inclusion in the benefit health packages, and we see this in Ghana and Zambia. Integration of childhood cancer in national policies has been seen in Ghana, Kenya, Mozambique, Uganda, Zambia, and Zimbabwe. And when we look at defining national standards guidelines for treatment, we have seen Zimbabwe coming up with their first national cancer treatment guidelines for childhood cancer. And we have Zambia developing those guidelines, Ghana, Senegal, and South Africa. Evaluation and monitoring, strengthening and linking cancer registries. We have the following countries that have been able to do that. And when we look at the enablers that are supporting the comprehensive policy, we've seen increased advocacy, stakeholder engagement, where we saw in Ghana, where the First Lady was part of the international strategic dialogue. We saw how they've also worked to ensure that childhood cancer was included in the national health insurance that's leveraging financing. We've seen Mozambique coming up with the national, the first investment case that has been put in Mozambique. We've seen linked policies and where we are seeing priority setting. Kenya looking at the priority setting that they put in to ensure that childhood cancer was included in their national insurance policies, that is the National Health Fund. And so when we see such massive changes that have been going on, we ask ourselves, what's next? What are some key considerations? What are some lessons that we've learned that will be able to look in for childhood cancer? Some key consideration as I end. GICC offers an opportunity to strengthen the broader cancer agenda at national level. The governance structure, including high-level political commitment and a multi-sectoral approach, is crucial to effectively move cancer programs forward. Policy making must include listening to the voices of those with lived experience. The survivors of childhood cancer must be around the table. Occurrence of cancer in pediatric age, and I'm talking to experts today, is generally not preventable. But those avoidable deaths that I talked about, we can avoid them through strong and ready health systems. We need rigorous cancer surveillance through systematic collection and analysis of data across hospital and population-based cancer registry. This is fundamental to inform policy formulation and to evaluate national programs. Childhood cancer should be integrated in the broader national programs on childhood cancer and adolescent health programs. Partnerships play a key, crucial role in the fight against childhood cancer and collaborative approaches. As we move forward, we must look at sustainable financing of childhood cancer, and this will happen when it is integrated with other programs from the primary health care all the way to treatment, that it should not be a verticalized program or siloed program where things are being done. I look forward to interacting with all of you. I look forward to us asking the hard questions. I look forward to finding solutions to the issues of childhood cancer in our region. I thank you.